Marianna Fontana, Professor of Cardiology at the University College London. I work at the National Disease Centre, and today I'm going to focus on the analysis of wild-type patients versus hereditary patients with ATTR cardiomyopathy treated with nexiguran ziclumeran in the phase 1 trial. This study aimed to address assessing if there are any difference in the efficacy and safety of nexiguran ziclumeran, known as Nexid, in patients with variant ATTR cardiomyopathy versus wild-type ATTR cardiomyopathy. This study is an ongoing phase 1 study which recruited 36 patients with hereditary or wild-type ATTR cardiomyopathy. And in the study, the phase 1 study consists of two different parts. Part 1, which was the dose-finding portion of the study, and Part 2, which was the dose expansion of the study, where every patient received a fixed dose of 55 milligram, which was the fixed equivalent dose of 0.7 milligram per kilo. 25 patients had wild-type disease, 11 patients had hereditary disease, and of these, 64% of the patients had a V142I mutation. The key findings of the study is that in terms of the primary endpoint, there was a deep, rapid, and sustained reduction in the TTR levels, irrespective of the TTR values at baseline and irrespective of the genotype in wild-type or hereditary. So the absolute TTR levels reached at 12 months was exactly the same in wild-type and hereditary patients, in keeping with a consistent treatment effect in both genotypes. And also the reduction was durable over time. So over the 24 months of observation, the values remained low and practically unchanged. And this reduction in the TTR levels was associated with evidence of stability on 3 known markers of disease progression, like the NT-proBNP, ultrasensitive troponin, and 6-minute walking test. And there was also evidence of stability or improvement on the quality of life and NYHA class. There were no safety concerns, and the most common AEs was cardiac failure, and this is extremely normal for patients with this condition, and it was similar in wild-type patients and hereditary patients. So there was a favorable safety and tolerability profile. The key take-home message from this is that one single infusion is associated with a deep, durable, and sustained reduction in the TTR levels in both the wild-type patients and the hereditary patients, and this is associated with stability on key markers of disease progression with no safety concerns. The phase 3 trial called Magnitude is actually ongoing and recruiting, so we are really keen to finish the recruitment as soon as possible, and then we will wait for the follow-up of the patients because we are really all excited to see the results of the Magnitude trial.